today's Family First, we are talking about weighted blankets, and this may seem appropriate given the forecast that we have coming up, but actually we're talking about some health benefits.
Yeah, they were designed as a therapeutic tool for people with sensory issues, but now they're being marketed for everyone.
Yeah, normally that's worrisome because the marketing that a product works tends to be way in front of the science in terms of proving that it does. But in this case, hey, it's just a blanket. If it feels good, then in a way it's working. But there's also good logic as to how they work. They decrease sensory input by sort of hugging you in a warm cocoon. Now, that may sound wonderful for some of you and not so wonderful for others, like the claustrophobic out there. But who have issues like processing disorders or even ADHD, those people can get a little more easily overwhelmed at times. But in a very innate
create that feeling of pressure and know that your kind of limbs are against your body. That feeling of pressure really is a sensory experience. And what we know about that sensory experience is that the tighter your space, for many people, not all people, not comfort.
As Dr. Laura Saunders from the Institute of Living, she said it can help in the same way that an anxious person can benefit by going into a dark and quiet room, again, to sort of calm a sense. Now, on a basis, forget about anxiety, Dr. be integrated into a
lot of it at night, helping them create a more safe and emotional and comforting space for sleep.
Yeah, so buyer's guide time. Don't know exactly what to tell you other than some of the websites I've seen have recommended maybe about 20%, I think, of your body weight is about the maximum you'd want.
Well,
so
I mean,
a 200-pound person is 40.
It's
a lot.
Right, you don't want too much.
But they are expensive. So you want to make sure you get one that's easily machine washable and one that segments. They usually use pellets to weight them, put them into sort of, so long as they're quilted into patches so they don't shift to one side.
Well, basically it has like a waffle pattern.
Yes.
You know, and it keeps, a certain amount of weight or pellets in each waffle segment. So
keeps the weight of the equilibrium of the blanket going on.
Right.
I asked this earlier, I'll ask it again because I'm curious. I mean, is still kind of figuring its way around here. Are there things that you should be looking for or avoid to suggest that you're getting fleeced by your fleece?
No. Hasn't looked into it a lot, but partly that's because there's no real known health concerns. Outside of one or two freak accidents where maybe an infant who should have been under it got suffocated.
Right, keep that in mind, especially if that's who you're using it for.
Yes, but that's, you probably shouldn't be using it for an infant. You swaddle.
First, and of course the weekend is when we spend a lot of time with our families, and we wanted to kind of do a weekend recap. This is what we did